Hi, I'm Marcus Cheatham, Health Officer at the Mid-Michigan District Health Department, serving Clinton, Gratiot, and Montcalm counties in central Michigan. We really need to reopen the Michigan economy. Um, Businesses are closing, people are losing jobs they're not going to get back. Healthcare and public health are looking at steep cuts right in the middle of a global pandemic, and it looks like state tax revenues are going to be severely diminished next year, and I don't know if we're ever going to be fixing those roads again. Fortunately, the Michigan Economic Recovery Council has prepared detailed guidance for us on how we can safely reopen the economy. And that's what I'm going to be talking today, urging you to implement those guidelines wherever you work. To lay the groundwork for that conversation, what I want to do is look at some data and information about uh, the pandemic in my three counties, because that will tell us what's continuing to drive this thing. This is the website of the Mid-Michigan District Health Department. If you come here and click, you will be taken to a data page, which includes a lot of cool information about what's going on. So I want to look at that now. So this graph tells the story of the outbreak from the beginning, back here on March 10th, when the first cases hit Michigan, up until now. The cumulative number of cases in our three counties has grown to 220. And included in that number is 15 deaths. People often ask, well, that's the cumulative number. How many people are sick right now today? And there's a formula that's used to calculate that. And that formula says if someone is still alive after 30 days, you can count them as recovered. And using that formula, we would say we have 88 people who are currently ill with COVID-19. And so that the burden of illness has come down somewhat since the peak of the pandemic back in April. We know that not all of those people are recovered. Sometimes people die after 30 days. Sometimes they recover sooner in only a week. But the formula is widely used, and it's probably a pretty reliable yardstick. So let's look at where this thing is happening. Here's a map of the three counties, Montcalm, Gratiot, and Clinton. And we kind of have two main hotspots. One is southern Clinton, and the other is western Montcalm. And of course, southern Clinton is adjacent to Lansing, and western Montcalm is adjacent to Grand Rapids. So there's a lot of travel back and forth between people who live in the counties but work in the cities. And we think that's where a lot of the transmission is coming from. One of the things that people wonder about is whether the hotspots are mostly where long-term care facilities are located. And that's generally not the case. It is the case for Pine River Township in Gratiot County, but for Watertown and Westphalia in Clinton, and for Bethany and Sidney in Montcalm, those are not correlated with long-term care facilities. So that's where this outbreak is happening. Let's look at another map that I really like. This is the number of daily new cases in our district. Again, starting back on March 10th, you can see we slowly got new cases until early April, and then we really had a spike. A lot of cases came in then, and then it went down to very low levels, and we've kind of had a second wave. Notice that in the first wave, it's mostly blue. That's Clinton County. Remember, Clinton County has 131 cases right now, and then you get the green and the red, which is Gratiot and Montcalm. So the pandemic kind of spread across Clinton County westwards and northwards into Gratiot and Montcalm. The dashed black line, the dotted black line, is there because we have been asked by the state Supreme Court to assist our local circuit courts and others to figure out when it's safe for them to reopen. and they like to use a statistic on 14 days, straight days of decline in COVID. Um, they call that gating criteria. And if you can get a continuous decline, then you can say to the courts, okay, you're ready to open. And I was very excited when I first got the request, because indeed we'd been at the end of a period of decline, but then it ticked back up again. And I think that's part of the reason why Governor Whitmer, in her last press conference, said there's no magic formula that's going to tell us when it's safe. We're going to be flying by the seat of our pants, and indeed, I think that's true. Here's one last chart, not a very pretty chart, but it's interesting. This is what we call probable cases. If you've been listening to people talk about COVID, you've heard them say these so-called cases that we report are only the cases that are known to public health. In fact, there are many more cases, and it's a lot of credible researchers say there are up to 10 times more cases than the cases that public health knows about. And we, as you know, we're in the middle of a shortage of testing materials. It's a national crisis. It's a crisis in the state of Michigan. So we can't test everybody who needs to be tested to determine if they're a case. So what the state is now encouraging physicians to do is, if they see somebody who was exposed to someone with COVID and has developed a fever, assume that it's COVID and call them a probable case. And we're going to start counting those. So that just happened. We don't have a lot of probable cases in our district yet. We have 30. But what that means is that eventually we're going to start counting those probable cases as cases. And so you're going to see a big bump over here somewhere. And the curve is going to jump up. And that doesn't mean there's suddenly a lot of new cases. It doesn't mean there's another wave starting. It means we're counting more cases, trying to get a better handle on what's really going on. So the main role of the Mid-Michigan District Health Department is in contact tracing. We do that by using a statewide database called the Michigan Disease Surveillance System. It enables all of the counties across the state to exchange information with each other. This COVID, it doesn't just spread within counties, it spreads all across the state. People live in one place and work in another, and that's a big part of why it's hard to stop this thing. People traveling around because they need to work, are continuing to spread it. There's some other limitations here. One is physicians and laboratories are supposed to report every case they get, but they often don't do that. Physicians are busy, they forget. We don't get reports of every cases. Laboratories are supposed to be reporting every case, but we've brought a lot of new labs online so that we can try to ramp up testing, and not all of the labs are connected to the Michigan Disease Surveillance System, so we're missing tests there. There's two other big challenges. One is, as you know by now, it's estimated that anywhere from a quarter to a half of people who ever have COVID are asymptomatic, especially right before their symptoms come on. It's right at the time the symptoms come on when you're at your most contagious. So that's a big problem. And then we have the problem of false negatives. The PCR testing that is the most reliable for identifying someone who has COVID right now, unfortunately, a third of the time will say someone's negative when they actually have it. And that's not a problem with the test. The test is very sensitive and specific. The problem is that the amount of viral RNA in people's bodies goes up and down. We don't understand all the reasons why, but sometimes when someone has it, there'll be a dip in the viral RNA, and so the PCR test can't detect it. So this means you need to take action right now to protect your business, the place you work, because COVID is out there. There are still problem businesses where COVID is spreading rapidly. So if you look at like low wage employment in factories, in agricultural work, especially where people are in congregate housing, we're still seeing big outbreaks. Warehouse work we're still seeing large outbreaks happening in those kinds of places. We have another threat, and that is COVID exhaustion. And COVID exhaustion is starting to turn into COVID denial. Uh, People have they're just tired of continuing to fight this thing, so they're engaging in more risky behavior. And then we have other people that are reacting by saying it's not even really there. Um, and that means that in your place of employment, getting compliance from your employees and your customers in terms of how they act is going to be a challenge. I've got a personal example in my life. My wife recently quit her job, and she had to do this because she works along someone who does not believe COVID is real, and she knows this because she sees his Facebook page. And so when they call her back to work, she's going to have to work right alongside this guy, and she doesn't trust her employer to be able to keep her safe from him. So she has quit to keep herself and me safe. And so you have the hardworking, long-serving, smart worker leaving, and the worker who might be placing his coworkers at risk still on the job. So that's going to be another big challenge for employers. And then I think a third consideration is liability. So we're already seeing lawsuits against long-term care facilities where they've had outbreaks. And I just want to emphasize the outbreaks that are happening in long-term care facilities most of the time are not the result of negligence. Most long-term care facilities, they're licensed, they're inspected. We work with them closely. We understand whether or not they have the skills to do the work that they have to do. And people also tell the story that it's folks from outside the community who are being brought in that are bringing the disease into the long-term care facilities. No, it's the employees. Half the people in a long-term care facility are employees, not residents, and they go back into their community, and some of them are keeping themselves safe and some aren't. At the very least, we know that screening fails because of people being asymptomatic, so they might be passing their tests, thermometer on the forehead, how are you feeling? I feel great. And they actually have it, and they eventually, there's a slip, and they make their patients or their coworkers sick. I'm telling you this story because all businesses and places of employment face that very threat. And so you have to do better than a long-term care facility to keep your business from getting hit with COVID. So one of the things I want to try to do is paint a picture for you of what it looks like when people are putting themselves at risk of COVID. And there's a simple formula for that. And that formula is that risk equals the dose of the vaccine times time. So how much of the vaccine is getting in somebody's face or on their hands, and then over what period of time. So you need a pretty large dose to get this. So you have to be around someone who's sick and shedding virus, and then you need to be around them for a period of time, like a half an hour, for example. So in your mind, I think you can start to formulate a picture of what's safe and what's unsafe. Going for a walk with your spouse where you've been sheltering in place together and you haven't been exposed to anyone else, totally safe. Riding in the same car as your buddy when you go golfing and you don't know if he's safe or not, and you're in that car for a half an hour or an hour, sitting right next to each other, talking at each other, not safe. So when they open up the bars and restaurants, are you all going to go out and go elbow to elbow with your pals and sit there for 2 hours drinking and talking at each other, spreading your COVID? No, that's very, very unsafe. Going shopping at a supermarket where there's not a lot of customers and there's a lot of space to go down the aisles, that's safe, especially if you just get in, do your shopping and get out, don't spend much time there. That is safe activity. So retail is a lot safer than, for example, entertainment. So some other things we've seen that I think people need to think about is there have been churches that have reopened and brought people into the church. And I've seen pictures of some of the services that have happened, and they've been safe services, socially distanced, people wearing masks. And yet there are still cases in these church services where people do wind up spreading the disease. And the reason that happens is because they're in there a long time, and also they sing. And so when you sing, you spew more virus and it gets through your mask. And so that's a less safe activity. And then we do have cases, as I've talked about, problematic employees. I've heard of a couple of cases of employees who knew they did have symptoms, but they rationalized the symptoms away and didn't report them. So they should have failed screening, but they didn't. Some questions that I know employers have: can I discipline employees for taking risky behavior? In other words, if I know somebody is going to drink at a bar, can I say that that's the same thing as, smoking pot, which I don't allow of employees in my workplace? And right now, that path has not been blazed. I cannot give you any advice about that, but it is something to think about. As if you read HR, human resources websites that give advice to employers, they always say the same thing. The one thing you need to do is to train your workforce to understand what's really going on, and what this workplace is supposed to look like, and how we're supposed to behave towards our customers and towards each other. And I have been searching desperately for really good short COVID training that you could require your employees to use before they come back on the job. And I haven't found it yet, so I have nothing to recommend to you. But that training is really, really critical. Okay, what I want to do now is take us to the website of the Michigan Economic Recovery Council to look at what they have. And here it is. The URL is blmcovid19.com. Does not sound like the Michigan Economic Recovery Council. If you just Google Michigan Economic Recovery Council, this is what will come up. The Recovery Council was created by Governor Whitmer so that business would be leading business during the recovery. She knew if she tried to tell business what to do, that would become problematic. And so she set up two groups to give her advice. Here's the Business Council. So it includes, GM, Dow, Small Business Association, Steelcase, Meyer, Herman Miller. It's just a who's who of business leaders in this state. Really phenomenal group. And then here's the Healthcare Advisory Group. All of the major universities and the major healthcare systems are here. If you're a Montcalm County person, you recognize the name of Tina Fries Decker. She was the CEO of the Spectrum campus in Greenville, and now she's the CEO of the whole system. So we miss her. And then this is Angelique Joins. She's the health officer for the Allegan County Health Department, and she's representing local public health. And so our voice is on there too. So that's a really great thing. So the guidance is broken up like this. There are four main sectors. There's manufacturing, office, healthcare, and entertainment. And then under each of the four areas, there's specific guidance for subsectors. So I want to look at the guidance for retail. There it is, retail. And there are themes to all of the advice for all of the different sectors, because there is a small set of best practices that really you just need to implement everywhere with some additional details. So for every sector, they focus on these 8 categories: response by owners, planning, check and entry protocols, personal protective equipment, if relevant, social distancing, relevant everywhere, cleaning and disinfecting, yes, do that. Then case monitoring protocols, that's being vigilant to see if you do have sick employees and what to do about that. I'm going to come back to that and talk a little more later. And then some restrictions that were already passed. So temporary closures, no, we're trying to open up now. And travel restrictions, we are learning that there are safer ways to travel now. And so the lockdown, no travel between states, the CDC no longer advises that. So then for each of these sections, there's more detailed advice below. So let's look at, first of all, facility entry, protocols. And so we'll scroll down to, there's the planning section, and then facility entry. So just, a lot of common sense advice that if you've ever gone shopping, you've already seen being put into place in retail: reduce congestion, screen employees, screen customers, facility check-in when people arrive for work. A lot of good illustrations of just what things should look like. So, socially distancing people as they enter a store, for pickup, at curbside delivery, spacing out the cars, channeling people through certain entrances, special shopping hours. The pictures to me are really helpful. Signage: if you're feeling sick, don't come to work today. A decision tree for helping employers to decide whether someone is sick or not. And then I'm going to scroll down past the PPE to social distancing, where they have more good pictures, that just show what a COVID-safe workplace really should look like. Merck, we've really struggled in Michigan. We have struggled to get sufficient tests, so we can tell where this pandemic is at. We have struggled to keep up with the burden of contact tracing. We don't have those things licked yet. Merck said, we're going to produce guidance. We're going to do it by a date certain, and it's going to be really good guidance. And they did that. And that's one of the things to me that's been, given me a little bit of hope, because somebody came through when we really needed them to. So last few things I want to say is the Merck guidance does talk about doing contact tracing for businesses. I would say don't do contact tracing yourself. If you even think you have a sick employee, or you have a question about an employee who might have done something risky outside of work, or if you know you have a case, always call your local health department, and you're going to want to talk to the disease control nurse for your county. And you can just go to the Mid-Michigan District Health Department website, just Google that, and call any of the numbers. They all go into the same queue, and you get a chance to push a button to talk to a disease control nurse. And please call us. If you have advice about setting up, complying with guidance, want someone to come look at your facility, again, you can call the health department, and in this case, ask for environmental health, and we will come out and look at your place, walk through, give you advice, and help you make those decisions. The last thing I want to say is, public health is being urged to help set a positive vision for the future. And a lot of what I've talked about so far is really confounding. It's harder to deal with this disease than we thought at the beginning. The two messages I would end with: you can keep yourself and your family safe just by staying home and staying out of high-risk environments. You really can do that. You can make it through this without illness in your family. And then the other is that you can keep your business safe. It doesn't mean you'll never have a case, but you'll know soon, and you'll be able to snuff it out and not have a lot of damage to your business. So implement this guidance, and it will work for you. So thank you very much. We'll have more videos as we get more information about what's coming.